May is Mental Health Awareness Month, and this pandemic can create an overlap on stress and depression. Our Keaundria Milloy spoke to a psychologist on how patients can cope.
In response to COVID-19, all residential facilities in Mississippi are still admitting patients for those who are struggling with symptoms of mental health. Licensed clinical health psychologist Dr. Datz says it is extremely important to tend to patients during the pandemic.
People are very isolated and confused right now. There's a lot of real stress, anxiety, and fear. And for people who are already diagnosed with mental illness, such as depression, anxiety, trauma, bipolar disorders, there are real issues of access to doctors and medications.
With the lack of mental health support during this time, people can see an increase in symptoms.
Any form of mental illness is likely to be exacerbated in the current circumstances because there's so much change and loss of control. I think it's okay not to be okay right now. I think there's a lot of pressure for people to feel like this is normal when it's not, even though we know it's not normal and it's a major accommodation. It's been around for 6 to 8 weeks now, and it's sort of becoming the new normal. And I think it's okay to acknowledge that this is stressful, that this is hard.
Patients who are dealing with circumstances should understand there is a form of hope.
Just understanding and being compassionate and patient with yourself. I often tell people to try to take things one day, 1 hour, or maybe even 15 minutes at a time. For people with severe problems, they definitely need to know that they can seek help.
If you're struggling with any form of mental disorder, facilities are still available via phone and online in your local area. I'm Keaundria Milloy in Meridian.